Standing in person today and those through Zoom, sorry. That's good, okay.
Oh, sorry.
We're good. All right, I'm gonna call the meeting to order at 5 o'clock on June 18th for our regular board meeting. And our land acknowledgement, as per request from IHAC, is to be try to be more personal. So something that is related to June, which is in Indigenous History Month. As I reflect on Indigenous History Month and National Indigenous Peoples Day this Saturday, June 21st, I am reminded of the importance of listening, learning, and honoring the stories and experiences of Indigenous peoples. This month is not only a time to celebrate the rich cultures, languages, and traditions that have shaped this land for thousands of years, but also a time to confront the truths of our shared history. It's important to acknowledge the deep and lasting impacts of colonialization, including the legacy of residential schools and ongoing challenges faced by the Indigenous communities. These truths are difficult but necessary to face if we are to move forward in genuine reconciliation. Indigenous History Month is a call to remember, to celebrate, to learn, and to act. I will try to carry this reflection with me, not just in June, but throughout the year. Are there any declarations of conflict of interest with anything to do with the agenda? Having heard none, if something comes up in the meeting, please let us know and we will note such. Adoption of the agenda. Are there any amendments to the agenda? The agenda was circulated prior to the meeting. Seeing none, can I have a motion to approve the agenda as circulated? Dan?
Ramesh.
Joyce? Sure.
Ramesh.
Okay, thank you. All those in favor?
Take it.
That is carried.
I'm gonna win.
The meetings of May 15th, 2025 were circulated again prior to the meeting. Are there any amendments? If not, can I have a motion to approve the minutes of May 15th?
So move.
I'll move it.
Okay. Ramesh and Councillor Richardson, second. All those in favor? That's carried. Thank you. Okay, business arising from the minutes, 5.1, which is governance working group. So you're aware in the May meeting, the board approved the formation of the working group to identify skills and gaps and opportunities to inform future member recruitment based on the province's desire to consider these based on a skills matrix, skill-based needs for the new board. As you all know, the provincial appointees were provided a one-year extension to their current position appointment, and so that will come up at the end of this year. And the province has asked us to provide feedback on that. I wanted to update the board that the membership of the working group includes myself, Mayor Hankitsky, and Councillors Rael, Joyce, and Machika. The group will meet approximately 3 times over the next few months, with the first meeting is actually occurring on Monday to review the matrix that was reviewed by members of the current board. Are there any questions on governance committee? How we're proceeding? No, hearing none. Okay. Can I get a motion to receive this for information? Thank you. Sorry. Yeah. Seconder. Okay, Councillor Joyce. All right, all those in favor? Thank you. Word Clark. Sorry.
Well, he is fine.
Too personal. Sorry.
No, no problem.
Word Clark. All right, so medical officer health update number 6. We'll get to Dr. Piggott.
Thanks.
The floor.
Good evening. Thank you, Chair, through you, and good evening, Board of Health. Happy summer solstice. Happy National Indigenous Peoples Day coming up this Saturday. And I just want to take a brief moment because there's not a lot of heavy content updates I want to provide today. Just to give some thanks and kudos for our team and lots of good work happening. So firstly, in the last couple of weeks, we've had our first measles cases. You'll hear in a report from Dr. Bocking later in the agenda. Tremendous work the teams have done, and my thanks for Dr. Bocking's leadership of our measles response work, which is really critically important for such an infectious and preventable virus. I also want to give some gratitude and thanks for public health teams, but also community members, and in particular, First Nation communities in this region who have welcomed with tremendously kind and open arms residents, new friends who have been evacuated from wildfires in the north into our region, into our community. It's been really humbling for me to see such kind support offered for folks in the region, and such quick action to mobilize supports and respond to health and other needs. So a big thank you to all those involved in helping those folks, and wishing them safe and peaceful time and returning to their homes. I want to give some thanks to our management team, who has met as a new full manager team post our new management team org structure for the first time on June 4th. We had a really lovely meeting together in person, and really, I think, inspiring connection, clearly common purpose towards bringing our teams together as a new health unit and leading us forward. In that vein as well, just our senior team, our full senior leadership team, who recently has begun a little bit more work around team development, team effectiveness, and I think those are really critical times and periods and conversations to be having as we try to work together to lead and serve our community as effectively as possible. All of our senior team is working tremendously hard. And it's really challenging because we have all of the routine work on side a desk and the merger work being layered on it. A colleague who had been through a merger had said it was more challenging than the COVID pandemic response to have gone through a merger, which was pretty intimidating for some of us who had been through the COVID response. But I do just want to thank our senior team. And on that note too, Larry later will provide an update on transformation. And I think there's a lot of great work happening in that as we build a transformation team. We build that work out. I just one last little anecdote here. Met with a wise CAO in the region who'd been through municipal amalgamations and gave me some advice this morning. Said merger is really challenging, but well worth it. And had 3 pieces of advice: communicate constantly and way more, 10 times more than you think you need to. Act with grace and patience. It's a hard journey and process. Be kind to each other in the journey. And thirdly, don't move people's desks. Which is not, the first 2 were on my radar. The third wasn't. He shared moving from office to cubicle, shuffling desks an inch right, left was more challenging than nearly any other decisions that had happened in his experience in municipal amalgamation. Anyway, I'll end by saying a big thanks to all our team doing this great work. Thanks.
Thank you, Dr. Pickett. Thank you, Dr. Pickett. Yeah, any of us that have been through mergers, yeah.
You go to brothers.
All that
the other
pain,
committee. Okay. Tell your brothers.
Is sometimes the medicine is worse than the result of the merger. So it does take time. Everybody has to have that level of patience and work towards the same ultimate goals. Are there any questions for Dr. Piggott with respect to his report or anything else? No, I haven't seen that. So can I get a motion to receive on? Oh, sorry.
Black, through you, just to add to the Indigenous communities that have been moved out. I know that several of the service organizations from the county have also given cash donations to help us because of the communities in full support behind them.
Yeah, thanks for those words, working hard. And Dr. Piggott told me that in our conversation just before the meeting that there's been a great community response to having those folks here, and so hopefully we can send them home with a positive positive approach to the future, given everything they've been through. So thanks for those words. All right, so I need a motion to receive the information. Mover. Councilor Chica, seconded by Mr. Marco. All those in favor? That's carried, thank you. We will move to consent items. Consent items are listed in section 9. The alpha letter regarding the tobacco settlement, the alpha letter regarding the provincial budget, the alpha letter regarding Bill 11, and then the stewardship committee minutes and Q1 financial report. Does anybody want to pull any of those items for discussion? Okay. First, nobody there? Okay. So I need a motion to receive the consent items as listed. You, Mr. Maloney, seconded by Gordon Clark. That'd be a little quicker, Ramesh. All right, all those in favor?
Thank you.
Good. All right, we'll go to reports. Stewardship Committee, the 2024 draft audited financial statements. I think we said Richard was going to be here. Oh, he just walked in. Okay, there, Richard. Yeah. Grab a seat, Richard, if you can. We're just at your spot.
Okay.
We don't want you to get comfortable, you know. All right, so Councilor Royale, our chair of East Online, right? Yeah. Would you like to open this piece, 8.1?
Yeah, we had an excellent meeting on the 13th. A couple of subjects came up that were noteworthy. Obviously, the audited financial report. As Richard would have said, there was a couple of amendments were made since then. Nothing that would be earth-shattering, but they were updates to a few budget and actual numbers of the consolidated statements. Bear in mind, there were two actual statements, one for the PPH and the second independent one for the HKPR. Obviously, because at the end of 2024, we were two separate units, so that's kind of sort of why you saw them the way they are. But at the end of the day, what we ended up coming up with, and according to what I'm hearing now in the amended one, is we will have reserves that are going to be in great shape for us going forward in 2025. From the HKPR, we have a number of roughly 1,598,542, and the PPH had a slightly larger number at 2,219,585. And the other big thing that we spoke about and everybody's been interested in is the whole idea of the levy harmonization. In light of what we heard at the retreat and the complexity involved with dealing with that, along with the rest of the challenges that we had, the steering committee made a decision that we would wait until we're going to have another meeting in July, August to go into that a little bit more in depth. However, in the 13th meeting, we had an extremely wholesome and productive meeting. And I think the process is right around the corner. We just needed that extra meeting to be able to bring something to you as a recommendation.
Great, thank you, Cecil. So the statements were circulated prior to meeting. The amendments, I think, went out yesterday, the minor amendments. Are there any questions for our auditor, Richard? Councilor Joyce?
I was waiting for anybody else there.
Go ahead.
Ask questions.
You're up.
I guess the reserves, I can't find that what you quoted, Councilor Ryle, in the documents. So if you can clarify the reserves, what page, it'd be great. I think you quoted that, but anyways, I could be wrong.
I believe they're listed in note 12 of the HKPR and the note 16 of the PPH. Again, I'm quoting what I know in terms of the reference points, but I can't explain the numbers for sure.
Folks, can we go through the chair, make sure we're following procedure here?
Yes, right. Sorry.
It's okay. Sure, can you, how many?
All right,
Okay.
yes, yeah, so, in the accumulated surplus note for, both health units, for Halliburton, for the Pine Ridge, the surplus there is in two components. One is just the surplus deficit in the public health programs, of about $3.4 million. That should be in note 13, I believe.
Oh, okay.
So, so the first line is the operating surplus. And then, of course, you have an unfunded liability in relation to both, employee future benefits and unfunded vacation pay. So that net number there is 1.5. And then if you go down to the last line in that note, the reserve funds contingencies is also equity that the health unit has there. Maybe those two numbers added together.
Okay.
Non-cash, yeah.
Okay, thank you. My other question is in terms of, salaries and wages in the consolidated statement. When I went back to the individual statements, they didn't add up. Well, I'm missing something or a gap somewhere.
Richard, will you just respond to
Oh,
that?
through the chair, so I apologize,
Yeah,
through the chair.
Okay, Warden Clark, you
Yes,
have a
the
comment?
chair, can we have page so-and-so when we're asking so that we can?
Put it up on the,
Yeah,
Screen or-
I think it would be.
what page do you want?
Page, are you on the PPH or HKP?
Yes.
Which section?
Oh,
That refers to both legacies. In both cases, they didn't add up, but either I'm missing something or.
Okay, so just as a general comment on both sets of statements, the statements attached at the back are required disclosures to assist the ministry in completing their reconciliation process. It doesn't pick up all the programs. So there are a number of other programs that don't require separate disclosure within the additional schedules in the financial statements. So that's why you can't add everything forward to the main consolidated statement.
Thank you through the chair. So we really look at the consolidated statements first. Okay, thank you very much.
okay, thank you. Any other questions for our auditor?
Chair?
Am I missing someone? Yeah, sorry, go ahead, Mayor Local.
Thank you. I'm just not familiar with the sewage disposal program. Can someone explain a little bit more about that for Peterborough?
Yeah, Dr. Pig is going to take that one.
Thank you through you, Chair. In November 2024, the Peterborough Public Health, Legacy Peterborough Public Health wrapped up a service that was being offered for most but not all municipalities in the region. We're one of about 10 health units still doing this as a legacy service. The board in 2023 had given direction to divest from this program. HKPR was not offering this service, so as part of divesting our contract to provide a public health inspection of the of sewage systems was discontinued, was not renewed. And as a result, the responsibility for that was returned to municipalities and sort of more of a better one-stop shop for building inspection anyway. So that program completed in November 2024.
And was that private services or big services?
It was private, or what was it?
Sorry, say that again, Mayor Logan, what was your question?
I was just wondering if that was households or was that large facilities?
Yes, households. Yeah, through you, Chair.
Households?
Private household, private dwellings, households, could have been commercial or other as well, but it wasn't larger municipal systems, obviously.
No.
And yes, again, that is a service that most municipalities do and offer, but we had a legacy contract to support that. So we in divesting from it, return that responsibility.
Thank you.
Thank you. Yeah, it was mostly county properties, like the 6 of the 8 municipalities, I think, a couple were doing it themselves, Durham and Northforth, I think were doing their own. Yeah, so it was just an association of that program. Warden Clark?
Yes, and through the chair, that program then had a small reserve then, which was just passed back, but we analyzed it and basically were not being able to be sustainable with it. And therefore it made sense that building inspectors from the municipalities, when they were out there looking at wiring, et cetera, could also do the same. So it was more efficient to turn that.
Do it back in this,
Yeah.
well, yeah, it's part of the building code act as well, so. Richard?
Thank you.
And maybe just as a piece of history, I believe HKPRD stopped providing those services about 10 years ago.
All right, any further questions for our auditor? Anybody on the screen? No, okay. Can I get a motion to approve the 2024 audited financial statements for Peterborough Public Health and the Halliburton Fourth of Pine Ridge District Health Unit? Motion. Mr. Maloney, seconded by Councillor Rial. Any further questions? All in favor? Thank you. Thank you very much. Richard, go ahead.
I steal just a minute or two of your time. Just as auditors, of course, we do have the pleasure of running through some standard verbiage with you and just maybe highlights some of the things that we are required to speak to. Just overall auditor independence, we believe we're still independent of the organization. Our responsibilities as the auditor is to gather the evidence to produce the auditor's report. So that is the main purpose of the audit. And as well to the Board of Health responsibilities are to ensure that the organization has internal controls, and as well to overall, we do a standard risk-based audit approach. Our auditor's report, we believe, will be issued as presented here today. We're not aware of anything subsequent that would impact that. Overall, our testing didn't reveal anything unique, illegal, questionable, or other acts in that manner. There were some significant accounting policy changes this year, but they didn't impact the organization. So that is just a summary there. And as well too, with any set of financial statements, there are some estimates involved. Nothing overly significant for the organization other than whether the ministry agrees with what you file your year-end reports with them. As well too, for we set a materiality for both organizations, and they remain fairly consistent year over year, with HKPRD being higher than PPH just based on the size of the organization. Overall, though we have no internal control matters we wish to bring to your attention or significant disagreements with the management, or we also request representation letter from management. There were no significant misstatements. As I mentioned Friday, just overall, there were 2 smaller amounts that were unadjusted in HKPRD. There's been an amount, in essence, an over accrual that's been set up for pay equity that still remains there for about 50,000, still well below the materiality limit, so we have no issues there. So, but it's still over our threshold that we have to tell you, but we're not suggesting that you make an adjustment. And in PPH this year, just because of the ministry finally reconciling some amounts, there were some additional items that were set up as payable in the past that now were brought into income because we didn't know that. So that was about $87,000. So that was to your benefit, but just needed to let you know that. So those were the only 2 items there. And there were no disagreements with management or difficulties encountered during the audit. So that's just a summary of how the whole audit process went.
Thank you, Richard. Any questions?
Yes, Richard, you stated the accounting policies were changed. Reminds me of the building code to add a few pages every time. Review. So why, like, what's the driving force? Why are they needed? Why do we need to change and change and change?
Well, that is set by the standard setters, both internationally, and then that filters down to the Canadian Public Sector Accounting Board. So it's just trying to provide what they feel that users are looking for with more information. I think the one change here that in 2024, although it didn't impact the health unit, it will impact your lower tier, so your own municipalities. It does in relation to, we talked about earlier, the building code. Well, within the building code, you do collect building permit fees. So now the new revenue standard states that you only report the revenue as to how much you think you've completed of the building permit, because of course building permits can go over multiple year ends. So then, as opposed to reporting it just when you receive the money, you're supposed to try and match that to where you're actually doing the work. So
That's unbelievable.
yes, yeah, I know. But yes, but yeah, it's just trying to what the standard setters believe to try and improve the financial reporting by public sector organizations.
Maybe we'll get it right one of these years.
Yes. Thanks, Richard. Any other subsequent questions for Richard? All right, again, thank you for all your work with staff and our board to bring the numbers forward in a timely fashion. We do appreciate that. Stuff that first at the end there that kind of went sideways, but nothing significant that would change anything really. So again, thank you for coming tonight and helping answer questions from the board directly. Thank you. We questioned real hard at the committee level. Thank you. One of the questions I had earlier this evening was in many organizations, you pass a motion to appoint the auditor for the coming year. We don't do that here. There's a bylaw that says the auditor for the public health unit is the auditor of the largest funder, which is Northumberland County. So wherever Northumberland County uses is the auditor for the health unit. So I had a question here. I don't know if anybody else said that. So that's how that decision is made. So there is no motion to appoint an auditor for next year. Okay. For information.
Still. Just through you, Chair, I think we still need a motion to appoint the auditor next year at the stewardship, like early in stewardship, and then at the board level next year. We usually do that at one of the first meetings of the steward, like of a finance stewardship committee meeting. But that's, I think, more of a formality. Selection is determined through the HPPA and our bylaw.
Yeah, so the motion would be appoint whoever.
Yeah.
Northumberland uses. Yeah, okay. Just for clarification. Thank you. All right. Shall move on to 8.2. Dr. Bocking is going to give us the measles updates. Dr. Bocking.
Good evening, everyone, through you, Mr. Chair. So happy to provide well, I don't know if I'm happy to, I'll reframe that. I will provide an update on measles activity, both provincially and locally. So I'll start by just giving a bit of background on the provincial context, because this is important to understand. Data is released every week provincially on Thursdays. So this data is accurate as of the end of last week. So in Ontario, we've seen over 2,000 cases of measles in 2025. This is more cases than we have seen in decades. The vast majority of cases in this in 2025 are associated with an outbreak that is its main sources in southwestern Ontario. So there are outbreak-related cases, which are the vast majority of the cases that we're seeing. We also have a very small number of cases that are related to travel, so primarily outside of the country to other countries where measles is endemic and people can be exposed. And then there's a small number of cases that we call sporadic cases, which means we don't know where people picked it up from. There could have been an exposure related to the outbreak, but we can't physically trace it to that. So those are really the main three types provincially that we're seeing. In the provincial context associated with the outbreak in southwestern Ontario, it's primarily impacting people that are not immunized. So 94% of those cases are among people that are not vaccinated. We have seen a significant number of hospital admissions associated with this, with over 140 hospital admissions, and that will have increased this week, primarily in youth and in infants. So locally, unfortunately, we joined the club. So there are currently 19 health units that are impacted by the outbreak in southwestern Ontario. And we've now seen 2 cases in the city of Kawartha Lakes, and they're directly associated with the outbreak with somebody that traveled from southwestern Ontario, unfortunately while infectious, and through exposure here, 2 cases identified in the city of Kawartha Lakes. There are also 2 confirmed cases in Peterborough City that are sporadic, so they're not associated with the outbreak, and we have not determined what the source is in terms of where they acquired the infection. What's unique about the cases that we've seen locally to date is that they have been among people that are either partially vaccinated or fully vaccinated. So this is what we would refer to as breakthrough cases, and we've had some interest in this in trying to understand why. The information that we share publicly and we focus on is that measles vaccine is very, very effective. It's not 100%. And in a population that is very highly vaccinated, you are going to see more breakthrough cases because the majority of the population is protected. And so when the vaccine is not 100%, you will still see some cases among those people that have received 2 doses of vaccine. What we're not seeing is rapid fire spread through a community that is not immunized, which is what is happening in southwestern Ontario. So while I anticipate we'll continue to see some cases, I think we're hopeful that this is not at this time leading to a scenario of rapidly increasing cases. To give you a sense of the health unit response, so when the health unit is informed of a confirmed measles case, and we primarily wait for laboratory confirmation, our first priority really is identifying who might have been exposed, because we want to identify who is at the highest risk of severe illness. We know that women that are pregnant, very young infants, and people with severely compromised immune systems can be at highest risk of complications. And if they're identified very quickly, they can be offered either medication or the vaccine to prevent serious illness from happening, which is why that initial response is so intensive in terms of identifying where people have been and who might have been exposed to the virus. Our second priority then really is trying to prevent any further spread. And because this virus is so contagious, one of the most contagious viruses that we know among humans is we're often a couple steps behind already. Because people are contagious typically for a few days before they're confirmed to have measles. So we focus then on identifying where are the exposure locations and determining, well, who is susceptible to measles? Can we get them vaccinated? Do they need to then isolate so that they are not going to further expose other people, particularly in high-risk settings like healthcare settings, schools, childcare centers, etc. So in the 4 cases that we've seen across our entire jurisdictions, we've had close to 300 contacts that we have followed up. There's one school setting where we had exposures, and there has been 4 or 5 public exposure locations that we have followed up contacts in. You would have seen media releases. This is a main tool for identifying and notifying people when there is an exposure location where we don't have a list of them. We don't know if it was at a restaurant. We don't necessarily have a list of all of the people that attended during that time period. We may know staff members, but in order to try to notify other members of the community to check their vaccination records, right now the main vehicle is media release, as the community is not used to this as of yet. In other settings where there have been multiple media releases, they moved in another direction, but the community needs to be aware of that. So our teams continue. This is a heavy workload, but we have smoothed out our processes, which I think is a silver lining. We knew this was going to happen at some point, and so it's been a good run through, and we're prepared for when we will inevitably likely see more cases. Key messages, I think, really for everybody to be taking back to municipalities, friends, colleagues, family members, is to check your vaccination records. At this point in time, we are recommending if people are traveling to other areas that have a lot of measles, and so that might include Southwestern Ontario, if people work regularly in those settings, that if they have infants between the age of 6 months and 1 year old, they can actually get an early dose of measles, mumps, rubella vaccine. If you're a child that has not yet received your booster dose, which would typically come between 4 to 6 years old, to get that booster dose early if you're going to a location that there's lots of measles, and as an adult to ensure that you have had 2 doses of vaccine. People born before 1970 are generally presumed to be immune to measles because there was so much measles activity at that point in time. And so at this point in time, there's not a recommendation for additional booster doses in that population. If people are unsure if they've had measles or what their records are, they can connect with their primary care provider. And if they're really unsure and quite worried, an additional dose of MMR vaccine is not harmful and will boost immunity. So I will pause there and happy to answer any questions.
Yeah, thank you, Dr. Baki, and I'm glad you went through the criteria for vaccination, again, for the public to understand it. I was in Ireland at the last meeting, and my grandson had his first birthday in Ireland, but we did get him his vaccination before we went. There are more issues over there with measles than there are here, and I'm glad we did do that. But it was a bit of a process to get that because he wasn't 1 year old yet, unfortunately. But anyway, we did get it done before we left. But any questions of Dr. Bachman, Councillor Rial, and then Warden Clark, and then Councillor Joyce.
To the chair, Dr. Bachman. So a lot of the outbreak was in southwestern Ontario. How do you isolate the people from, if they want to still travel? I mean, they're going to come somewhere and spread the measles. So what role does the public health play, especially there, and us, trying to prevent it from coming this way and potentially not an epidemic?
Mm-hmm. So this is part of why contact tracing is so intensive, because we do try and contact everyone that might have been exposed to another case. Now, we don't issue orders, for example, to quarantine or isolate people. There's not kind of that they have to stay home. We highly encourage that if they are, as soon as they are symptomatic, that they isolate, they contact a healthcare provider. They are encouraged to contact the healthcare provider before showing up in person so that proper precautions are taken for when they're tested. But there are so many cases in southwestern Ontario that there's also many people that are not accessing testing and may not know that they have measles and might travel while they have a runny nose that they wouldn't think is measles. And then 3 days after they've been in another area, they develop the rash and realize it could be measles. And that's one of the challenges associated with kind of how this virus shows up clinically.
Thank you. Here. Warden Clark? No, we're going to have, yeah, Warden Clark next.
Through the chair, Dr. Balking, a couple of things. I certainly understand if you're autoimmune challenged, that, you know, your immunity is down, but you spoke of breakthrough cases. If you do have a breakthrough where that isn't the situation where you're autoimmune compromised, are the symptoms less severe with the breakthrough?
Yes, that's correct.
And thank you.
Thank you. Councillor Joyce and then Councillor Raya.
Screen is.
Yes, thank you. Through you, Chair. My question is, you don't do anything until the lab test comes back. Makes sense. How long does that take?
So, and I will caveat that if there is a confirmed link to another case and somebody develops symptoms, we won't wait for the lab test to come back. But if it is somebody in the community generally that has presented with a runny nose, a cough, and then a rash a couple days later, that could be a large number of different viruses. Right now, the testing turnaround is 48 to 72 hours before we get an initial test back that's positive. People are asked to isolate during that time frame so that because they have symptoms and until it's confirmed, clinicians right now are telling people to isolate until we know for sure whether or not it's measles.
Thank you for the answer. I'm just surprised that given measles is so infectious, given that it's top of mind right now, I think it's more top of mind than COVID, which is still will be forever with us. I'm still surprised it's taking that long that they can't turn it around faster, given how it's more urgent. That's not a question. It's just the comment. I'm surprised.
Thank you, Councillor Joyce. Yeah, and Councillor Royale.
Yeah, I guess my question is more related to, we haven't had this thing for such a long period of time, and now there are so many people getting it. It's so infectious. Is it the kind of disease that could mutate similar to what influenza and COVID do? Which means some of our vaccines may become redundant.
So I'm not a virologist, so I'm not an expert in this area, but my understanding is that's highly unlikely. It does not mutate the same way as influenza or COVID. If we think about this vaccine actually has been available and used effectively for over 50 years, and it hasn't needed to be adapted to adjust to any changes in the strain. So I think that's certainly in our favor. And it is a very preventable illness through the vaccine.
Thank you. And Dr. Stelzer? Yeah, you're on mute there, Dr. Stelzer.
Thank you. To you, Mr. Chair. Since we are facing a fairly small outbreak at the moment, but necessarily very important and worrisome in view of the infectiousness, are there any financial resources or any implications for us, especially during the merger times, that would mitigate a larger outbreak or would put us at some element of risk financially or otherwise in the future? I know we are prepared for outbreaks in other situations, but how about this one, measles?
So historically, the province has provided one-time funding to health units to compensate for one-off events that result in significant financial increases to the health unit. With this outbreak, the province has shared with health units that they will offer one-time funding. And so we're tracking actually already specific expenses that might, such as, for example, additional overtime that is associated with this response in particular.
Thank you.
Thanks, Dr. Stelzer. Dr. Pickett?
And I just wanted to add all great points from Dr. Bocking, but just contextually and financially, again, this is one of the reasons that stable funding for public health at a health and protection level, responding to outbreaks, responding to infectious disease threats is so critical. You'll recall a couple of years ago, the Chief Medical Officer of Health of Ontario produced a report called Being Ready. It had an umbrella on the cover, and it really outlined we learned from COVID that we need to be ready for emerging and re-emerging infectious disease threats. So while we're focused on measles this month, last year there was significant increase in pertussis, another vaccine preventable disease. There was the emergence of Mpox, previously rarely seen infection causing significant public health strain and response. And so there has been emerging, re-emerging infectious diseases on a monthly, annual basis, essentially, especially in the aftermath of COVID-19 and the advent of the pandemic. So I just want to underscore as well, one-time funding is inadequate for sustainable capacity to be able to respond to what is a predictable now stream of re-emerging infectious disease threats.
Thank you. Any other questions for Dr. Bocking? All good information. Thank you, Dr. Bocking, for that. Really appreciate updating everyone. Dr. Figure said, the funding issue is not going away. But we have had several requests put into AMO for meetings with the Ministry of Health to advocate for those funding. I believe Haliburton has put a request in, several counties, Peterborough County. I'm not sure if Northumberland. No, okay. So we have two shots at getting in to see the minister once, maybe, to bring our case forward. But yeah, there has to be more consistent funding, more sustainable funding for health units, and hopefully we can get putting together a very good package that talks about the challenges that both health units have had, why we need to merge in many ways, and that the level of funding over the last 20 years has not been sustainable. And compared to funding that hospitals get, other parts of the healthcare system get, we're definitely health units are definitely on the lower end of the budget number with the province. So we need to do that advocacy ourselves, I think, to make sure that we get well represented in front of them when it comes to budgets. So thanks for those comments as well. All right, can I get a motion to receive the measles update from Dr. Bocking?
Another question.
Oh, sorry, there's another question. Who's that from? Oh, Councillor Ryle. Okay, sorry.
The question is not necessarily related to measles itself. It's more related to the funding that we've been speaking about and the decision that the province of Alberta has now done with relation to COVID. I mean, they've actually decided to remove that. If you want to get a COVID shot and you're not in that very short list, it's going to cost you $110. Do you, through you, Chair, is there any insight as to whether anything like that could happen in our province, or is it something that's still totally up in the air?
Answer for that. I haven't heard that. Any other members? Dr. Bocking? Yeah.
Through you, Mr. Chair, certainly there's been no indication from the province that they're moving in that direction related to vaccine delivery and COVID-19 specifically. There's already information being put out about preparing for fall immunization campaigns. We know that they're also very supportive of rollout, for example, of RSV vaccine that we saw last year. So this has been a strong, I think, emphasis and policy direction from the province.
Dr. Bocking, I hope there was many lessons learned through COVID regarding vaccines, that the province is taking maybe a more proactive approach to funding it and then making sure that the sustainability is there when things do happen. So there's those. All right, so I need a motion to receive the measles update from Dr. Bocking. Thank you. Paul, sorry, Mr. Johnson, sorry. Second. Sorry. Doesn't get called Mr. very often. I knew it was Paul. Seconder for that. I'll give a second to anybody on the screen. Dr. Stelzer, thank you. All those in favor? Thank you, that's carried. All right, we will move to 8.3, merger update. Mr. Stinson is on the floor.
Thank you. Actually, before I start, I just wanted to check with you, Chair, on whether we need a motion to approve the audited financial statements as a board. I don't think we did that.
Yeah, we did.
Okay, we had a motion. Okay, so we did. We just declined doing the other motion. I just wanted to make sure we had covered that.
Yeah, no, we're good.
Okay.
Thank you.
Thank you for the opportunity for a few minutes tonight to talk about the merger and our progress to date. I really have two parts to the merger update. The first was to share a tool that, the tracking tool that we shared with staff yesterday, and to give a bit of a sense of where we've come from and where we are today. And the second is just a few slides to talk about the current activities with respect to the transformation team. So start with the merger update report, the merger map report. The purpose of sharing this with staff this week was to take a moment to reflect on how far we've come and really to celebrate what has been accomplished so far. And really putting into perspective that we are still very early in the merger process, the long journey that we're on. And the finish line is not just around the corner, because I think there's always this idea sometimes where we feel like there's a decision to merge and now it's all just going to happen. And it is quite a journey. And to be successful, we really need to move at a pace of adoption, which means we're not just checking off boxes as we go along, but we're getting it right and we're moving forward in a positive way and meeting those transformation goals that we all identified up front. So first, I want to note that this merger map is not intended to be a comprehensive document that includes everything that has happened or is happening with respect to the merger, and that there's certainly going to be more things involved that as we move along that we'll need to add to this that we know will be coming but haven't started yet. So when we look at this, the starting point is 2024, but just a reminder that it was actually August of 2023 when the province said that voluntary mergers were available and there would be funding for this, and those who are interested should start to step forward. And we started our work collectively right away by bringing in a consultant to look at feasibility. So it's been almost 2 years since we first started talking about this for the most recent version of our merger discussions. So it has been a long journey already. But as you look at 2024, we obviously had some very early pieces that had to be done in terms of developing a business case. We had to work at coordinating our communications. We had to work at building the infrastructure through a joint merger steering committee. And then there was some very practical things like initial work on the branding and name that we needed to work on, and some early work on some things like payroll and IT that we needed to prepare for if the merger went ahead. And as you all know, that it was late December in 2024 that we got the decision to move ahead with the merger. So we'll flip ahead to 2025. So as of January 1st, of course, we flagged the fact that we are a new entity. The two boards that previously governed the two organizations ceased to exist and a new one was formed. We had to develop some new board policies, as you know, had to have a consolidated 2025 cost sharing budget, and we formed our board's committees to support this work. And then, of course, we had a number of tasks that we needed to do just to get off the ground and running as a new organization. We needed a single accounting system and to move towards a single bank account. So that was early this year. We had to define the future state roles for senior leaders and managers. Once they were defined, we also had to support people, that leadership team, to be able to have the tools they needed to move ahead, whether that was on change management or quality improvement, things like leveraging our strengths as a team. And then we had to create the support system that's needed for all the merger projects that are yet to come. So we call that our transformation team. So that was part of our management structure. So the people have been identified for that. And then we also, as you will learn later tonight, come very close now to being able to launch our brand. So just looking at where we are today and looking back, it has been quite a number of accomplishments. And on a lot of fronts, I think it's important for our staff, and as I think Thomas in his opening remarks commented, it's important to reflect on these and accept the fact that we have done a lot of good work so far. But then looking ahead, we know that there's a lot more to be done. When you look ahead at 2026 on this merger map, it looks relatively blank at this time. Some major things here with our strategic plan and moving ahead with our evaluation plans for the merger itself. So those are things we know that are coming, but the merger transformation team has been working with the senior leaders and identifying all the projects, and we know there's a lot more yet to come. So I'll move now to the update from our transformation team itself. And I'll comment first that this is more of a qualitative report versus quantitative to reflect where we are at this time. And I'll talk a bit more about that at the end of the slides. So the work to date has largely been tasks that were required to allow us to operate as one organization and to support what's needed to implement the rest of the projects. So the first slide here, you can see the future state of leaders and managers was a major accomplishment. And part of that, as I mentioned, was the transformation team members. So I have 2 managers to support myself as Chief Transformation Officer, to support change management and project management. We're in the process of recruiting staff to support them. And that team will be there to support all of the other leaders, project managers throughout the balance of the merger. We also, again, set up for some teams that we need to be able to have the strengths. So there's change management training that's happened, project management training specifically for our transformation team. Matthew can comment more on the second item here. We've began the Placerta process this week. It itself is a long journey, but the first step was taken this week. We have submitted our year 2 budget for the merger. So that takes us from April of this year till March of 2026. We actually just today are submitting some additional information to the ministry as they've requested. And then we will wait for approval of that requested amount, but do anticipate that it will get approved. And then the last bullet on here is working with the other mergers across the province. So I get asked this question regularly, and yes, we do network regularly with people, and the ministry itself has set up some specific tables to facilitate some of this collaboration and sharing of information, specifically around things like IT and merger evaluation. So in terms of the projects, I mentioned that we're in the process of developing the transformation team support system, but to do the first step is really creating what's called a project registry. We need to find out what all the projects are that need to happen, and then what level of support is needed from this centralized team. Our initial assessment, there's over 40 projects listed on our registry right now, and we'll need to identify, what level of support. Of course, these are spread over time, so they're not all happening right now, but that will give you some indication of how much work there is to make this happen. And it will give us also another way of reporting back to you in terms of the progress on those specific projects. Just a couple of highlights, though, that I think are important. We did complete the insurance transaction or transition, including maintaining tail insurance. This was something that is important. So as you leave one insurer and move to another insurer, you need to make sure your initial insurer has tail insurance, tail as in tail of a dog, because there may be things that have happened during the time that they were your insurer that come to light later on. So the general recommendation is to have tail insurance for 12 months, which we have done. I mentioned the branding already, and that's more information coming soon. And probably the biggest part of harmonization, as you might expect, is the program harmonization. And there was quite a bit of work done in this, starting way back even in the pre-planning stage. So I think we're in a very good position with that, and that will continue. But just wanted to highlight the fact that there's one sort of pilot test being done right now, so we can learn from what that process will look like as we move towards a merged program. And there's also a manager that's facilitating a community of practice, so we can learn from the experiences as we go. So I think there's a tremendous amount of work that's being done there and supported by the broad senior leader team that supports the program. And the last bullet on this is the IT integration. So we did start this work early as pre-merger, but now we're actually moving into some things, moving towards a single tenant in SharePoint, and that work will begin this summer and move it through the fall, team by team. So that work has been structured by our IT manager, and obviously we'll need a lot of change management support for that one, because that's an area where staff need to be supported through the process. Last slide, or next slide, not last. We also want to ensure through this process that our leaders and our staff are set up for success. That means supporting well-being and making sure we have things like temporary access to additional benefits is going to support the well-being of staff. We also, as I said earlier, wanted our senior team and our people managers to have the skills they need in a merger process. So we've done incredible amount of training over the last little bit, a lot of days spent together on those things, and especially around things like CQI and our change management skills, as well as things just like building a team itself for the senior leadership group. And last week with some work with the Queen's University program to how to manage in a unionized environment. So we're all using the same language when we talk about that. Moving to the next slide. As I mentioned, the transformation team is intending to work towards a consistent reporting process for the board. That should reflect what we heard from you when we were at the board retreat. That was one of the questions, if you recall, we asked. So there were things that came forward, for example, like making sure we align our objectives with the findings of reinvesting efficiencies and how we've enhanced program delivery. So how can we report to that in a meaningful way? We also just need some good success stories, so things that we can highlight. I know we've had a couple of financial ones so far, but there are other things that happen just in terms of how the program has evolved through this process. And we want to make sure that we're engaging and communicating with stakeholders throughout the process. It's not just we started our merger process and tell them when it's finished. We want to make sure we're communicating more broadly. And then we also want to report on the staff's progress through this journey. That there's a strong staff working together. And again, I know there's some work being done, again, through Matthew's team to look at some of the indicators that might come out of that. So the last slide, and well, that was the last slide, sorry. So I'll wrap up there and take a moment for questions if there are any. To the board chair, thanks.
Yeah, thank you, Mr. Thank you, Mr. Simpson, for that great report. Questions from the board? Councillor Joyce.
Thank you through the chair. That's a great presentation. Thank you very much. Very clear and concise, except for one thing. I go through this stuff in advance, and it's the acronyms. We all have our professions. If I throw a CEHP at you, I know what that means, but you probably don't. So just for clarification, what is PSLRTA? I got more. And, well, I'm going to name them all then while we're at it. CQI and the SLP. So sorry, I just don't know what they mean.
All right. So through you, board chair, this acronym, the CERTA, is actually Public Service Relation Transition Act. Did I get that right now? Or are you getting it out of order? So that's the act that dictates when you have multiple unions that have to come together, what process you have to follow.
Okay.
And CQI is continuous quality improvement. Was there another one? Sorry.
Yes.
SLT.
Senior leadership team.
Okay. Thank you for that. If we could, whenever we're using an acronym, just kind of put a definition somewhere in there would be helpful. I would appreciate it.
Yeah, great suggestion. Thank you.
Thank you for that. Councillor Rial.
She's okay. So to the chair, to Larry, I imagine you're doing this here, but boards that have already merged, are you in contact with them? Best practices, what they found out and the pitfalls of merging, or I would imagine you've done that, doing that, but have you done that? Reached out to the other ones, find out what, so we don't have the same pitfalls or whatever, or expenses that we should have said, oh, give you I guess we shouldn't have gone down that path, so.
Thank you, Chair. Definitely, there's only two examples, actually three examples in Ontario in public health where there's been mergers previously. The Southwest, the Huron Perth, and Simcoe Muskoka. I guess Parry Sound North Bay as well. I think that was part of that. So, but I have colleagues in all of those organizations that I've spoken to, even through the merger feasibility studies, up until now that we connect with regularly. And as I mentioned in one of the slides, there are tables where different people doing different work in each of the four current merging health units are talking to each other about what they've learned and where possible collaborating on things. So there's definitely a lot of experience that we can learn from in Ontario Public Health. Our consultants have also brought information to the table. And then there's people even on our team, like Matthew here, who's been through mergers, not in public health, but brings forward relevant information. So I think, yeah, we definitely take the opportunity to learn from whoever has that experience.
Thank you.
Thanks, Larry. Yeah, just to add to that too, from a board perspective, the province has set up quarterly meetings of the board chairs and MOHs to meet, and we met last week to talk about governance issues and those sorts of things and where the ministry can help us. And it also provides a roundtable for the chairs and MOHs to ask the province questions and again, try to collaborate on different things too. So it's happening in a lot of different avenues, and we're trying to keep all of the lines of communication wide open right now. So as you say, best to learn, best practice, and hopefully things move along a little quicker. Councillor Royale.
Just through you, Mr. Chair, we obviously don't have anything yet with the health standard. I mean, we're not going to get that until the year's over anyway. But when it comes down to what we would call the umbrella of critical services that we want to supply, again, we now have 2 units and becoming 1. Some of the critical services that were in 1 were more contributory or fed more people in the 1 than they were in the other. Are we going to be able to get in the fall, and I don't expect that anything before that, but in the fall to be able to look at those kinds of services and to be able to say, hey, this is what we got to do, because again, we're going to be number crunching in the fall, and it's not going to be nice. So is that part of the program to be able to look and say, where are we able to reduce, but at the same time, these are the critical services that we cannot compromise?
Thanks for the question, Cecil. I'm not hearing anything new on the program requirements down the road yet, so we are working in a bit of a blind alley at this point. I think, you know, the things that Larry's brought up with respect to program harmonization, I think we're taking a great approach to that, bringing in consultants outside to look at programs, and not just a matter of meshing them together. It's a matter of looking at data, looking at who we serve, getting feedback from those who we serve. Is the program we're doing today the right program, or the things that we should enhance, the things that we need to take away? So, you know, that does take some time. Hopefully we know by the end of the year a little bit more about what programs are going to be required, which ones might go away, or which ones will be added. So, but I think in the meantime, we have a very a robust process to look at each program that we have, the legacy programs, and come up with a program that improves service. Might have some productivity, might have some initiatives around IT, you know, all those AI, all those things. I think it's the perfect opportunity to look down all those avenues to come up with a better product than we've had in the past even. So, but to answer your question, we don't have any more information today, Councillor Ryan. Okay. All right, any other questions? Mr. Johnson.
Through your chair, just a quick, it might not really be a question, more kind of like a forward-thinking thing. Has there been any discussions with the province to upload IT services? Because that's not our wheelhouse, and they can do a lot of stuff better than us if they centralize it with regards to capacity on demand, with regards to security, disaster recovery, upgrades and updates, shared facilities. I'd like to see more of our money go to people on the streets than local IT services. You know, the technology's phenomenal nowadays. There's no reason why we need to do it if the province is willing to take it on. And I've been tickling ears to get that happening.
Thanks for the question. I'm not sure who can answer that the best.
Sure.
You, sir? Dr. Peggy?
So, no, thanks for the call, for the question through you, Chair. There has not been that level of offer engagement interest from the province. There has, though, been several working group conversations around movement towards IT solutions that would be centralized and provincialized. And there has been some collaboration and discussions, including direction from the province to be very careful that we're not headed down IT paths when they're trying to centralize or solve solutions that are divergent. So we still lack an immunization record, common electronic or collaborative health record for the province. We have a very outdated, archaic system for some of the immunization data that we do have and infectious disease tracking. So there's a lot of interest in work on IT solutions at the provincial level. There's also conversations on national level solutions and potential funding. So we're being tied into all of those, but they're at a very more piecemeal level, not an overall strategic level. And, being an independent organization, I think clearly, we do have local needs that need to be addressed, and will likely continue to. They haven't done that for other sectors, education, hospitals, et cetera. So I think I'm not anticipating that anytime soon, but I think better support and coordination and efficiencies definitely makes sense.
Thank you, Dr. Frank. Councillor Joyce.
Yes, through you, Chair, to add on to that, I'm on the library committee for City of Port Lakes. The province is looking at, it's not done it yet, but the e-library. All the individual libraries across the province buy their own e-libraries. The province is looking at buying one, the entire province, where we all have then access. So they're just throwing that out there that if that happens, you'll see the beginning of that kind of movement from the province, theoretically across other areas.
Certainly would be nice, working in healthcare for the last 45 years. There's not even a common health record in the province between hospitals and so on at this point. So I think we're a little bit further down the line, and they've tried many times, spent millions and millions of dollars on consultants trying to bridge all these different softwares. And I'm not sure if there's even common software amongst health units in the province. Are we all just everything?
For you, Chair, for a variety of things, there are common. So, for example, Legacy Peterborough Public Health jumped on to a collaborative health record contract and arrangement that HKPR was already on with a number of other health units, not all of them. Right. So there's definitely people that want to work together, find efficiencies, but there aren't directed provincial one-stop shop solutions for many of our things and needs. Certainly, the COVID-19 pandemic highlighted the need. There was movement around COVAX and the CCM software, a couple of Salesforce-based softwares that were single provincial solutions because there was so much challenge in early COVID without the ability to track and collate. Unfortunately, those weren't rolled into a sustainable solution. So there's now effort to seek that, but I don't think it's imminent.
Thank you. Any other questions? All right, so can we get a motion to receive the merger update information? Thank you, Mr. Johnson in Warden Park. All those in favor? Harry, thank you. Thanks, Larry. All right, move 8.4. Association of Local Health Agencies Annual and General Meeting resolutions. So the resolutions were circulated prior to the meeting, 825 and 01 and 825-02. We have a chance to look at them. Pretty straightforward. Any questions on them? No. Great. Well, a motion to sorry, Mr. Johnson, go ahead.
Just a quickie, I guess what page was it on? Hold on.
They
Got a page number, 25 of 49 from the Alpha presentation regarding allocation of votes.
Yeah.
And they'd have like 20 for Toronto. And when they use something like 8 for Ottawa, Peel, York, does that mean 8 each or 8 between the three?
page for whoever's there. So, yeah, we have 6. There's 3 of us going. We'll each have 2 votes, basically. So the organization has 6 votes. However you present those in the meeting, I think is, they give you cards or something, probably, or, what do they do? It's my first time.
So sorry, through you, Chair. The answer to your question, Paul, is yes. So for each of Ottawa's 8, Peel 8, York 8. So the table on the right is vote voting the delegates per health unit in that block, but their population weighted.
Cool.
Actually, sure, stand.
Okay, thanks, you. Any other questions on the 2 motions being brought forward? All right, can I get a motion to support the 2 resolutions? Then we'll do so at the meeting. Motion? Support the resolutions, can I have a mover? Put it online. Mr. Richardson, and seconded by Councilor Lachika. All those in favor? It's carried, thank you. Dealt with the consent items. Any new business members of the board want to bring forward? Seeing that, we'll move to correspondence for direction. And it is to endorse a letter from Windsor, Essex, with the additional recommendation to revive Bill 173, the Intimate Partner Violence Epidemic Act, I believe, which died on the table. Previous, provincial. Okay. All right, any discussion on that? A motion to endorse? That's right.
Through you, Chair. I didn't know if Holly wanted to speak to this at all. Yeah, no, I think it's fairly self-explanatory, but obviously just understood the critical issue.
All right, so I need a motion to endorse the letter from Windsor, Essex, and the recommendation to revive Bill 173. Thank you, Mr. Maloney, seconded by Dr. Stelzer. Okay, Dr. Stelzer, all those in favor? That's carried, thank you. We will now move to our in-camera session. I get a motion to proceed to in-camera to discuss 3 items in accordance with the Municipal Act. Gordon Clark, seconded by Mr. Marshall. All those in favor? Thank you, and we will move into camera. Thank you. All right, so, after the motion to dissolve, so, right, yeah, okay, motion to dissolve, the in-camera session and return to open. We had Clark and we all for good, so, okay, we did it in live now, okay, thank you, all in favor, that's carried. Okay, so the motion, that was presented in camera, can I get a mover and a seconder for that? Yeah, sure. All right, this time, yeah. And we have, Mayor Lowell and, Dr. Makisha. There we go. Okay, is everybody good? All those in favor? Thank you, that's carried. And our last item, our next meeting date is September 11th from 9 till 11:30 a.m. at the Port Hope office. Okay, off with that. Concerns? No? All right. Sure. Appreciate everybody's extended time tonight. It's a warm night. Nice to get home, but I do appreciate and see you all in September. And I need a motion to adjourn. Thank you, Mr. Maloney. I don't really need exactly there. Nobody against. We're adjourned at 7:12.
Take care, everyone. Have a great summer.
Stay safe, everyone.
At the boyfriend, at the swimming pool, boyfriend swimming pool.
At least it was